We're coming up next. You're listening to The Vegas Take. All right, welcome back. It is The Vegas Take. Sharp and Shapiro. So glad you could join us on a Thursday, Corona Thursday, sadly, I guess you could call it. We've just learned all these college basketball tournaments, including those in Las Vegas, have been canceled. But how has the government responded to this? We've been talking a lot about that over the course of the last week or so. Well, now it's hit ahead. And the lady joining us right now on the line knows more than ever. She wrote an article in the New York Times. Her name is Dr. Sherry Fink. Doctor, thank you so much for joining us. How are you?
Hi, I'm tired, like we all are, I think.
Yeah,
and,
no question.
Not feeling great about what's happening, definitely.
No, I don't think anybody should. So, Doctor, what I want to do for you first is I want to play for you a little piece that Morning Joe put together on MSNBC this morning. And what it is it's the comments that Donald Trump has made over the course of the last few weeks, kind of downplaying the coronavirus, and then pieces from his speech yesterday. It's about a minute or so. So I want to play this for you, and then I want you to comment on it. This is Donald Trump in his own words in the course of the last few weeks.
We're finding very little problem. Now, you treat this like a flu. This is the most aggressive and comprehensive effort to confront a foreign virus in modern history. It's going to disappear. One day, it's like a miracle. It will disappear. We will be suspending all travel from Europe to the United States for the next 30 days.
We have thousands or hundreds of thousands of people that get better just by sitting around and even going to work. Some of them go to work.
If you are sick or not feeling well, stay home. The Democrats are politicizing the coronavirus. This is their new hoax. We must put politics aside, stop the partisanship, and unify together as one nation.
All right, so those are the past comments of Donald Trump over the last few weeks compared to last night in the Oval Office. Dr. Fink, what's your reaction to that? Because it's mind-boggling to me.
Okay, well, listen, first of all, some of those were cut back and forth, without the context around them. And so I want to say, yes, I think a lot of people have been confused, and the message certainly has shifted around and changed and not been consistent. I want to say a couple things about that. One is we know what kind of a communicator the president is. I think when it comes to a public health emergency, the president communicates very colloquially. He's off the cuff. He says what's on his mind. There was a good article that I think NPR did about just that style of communication and how that can be confusing. I mean, he is right in some ways. For example, there are most of the people who get the virus have flu-like symptoms. That part's true. Researchers hope that it will get less common in the U.S. during the warmer months. So it sounded like a definitive statement, but in fact it is something that experts are talking about. So, cutting here and there, I just feel like I concluded a long time ago that is just kind of a waste of time to focus on the little sound bites. And what we've really got to do is listen to the public health experts. They are being allowed to speak, and their message has been consistent. And this thing has shifted in the U.S. because we now know that there is community transmission here. We didn't know that for a while because we weren't testing a lot, unfortunately. So we're behind the eight ball. And the one thing that is true that President Trump, that I think everybody can agree with, that he said last night, which is it's not really the time to be partisan. It is really the time to act to try to protect
I agree.
Health and safety.
Listen, we both agree on that. So now moving forward, I have to ask you this question. Why is it so difficult for people to be tested? How are we not in a situation where everybody can be tested? Isn't that a concern for many?
I think it's definitely a concern. And in our reporting, we've heard over and over again from doctors and from people who are, have symptoms that are consistent with the coronavirus. Again, very vague symptoms that we might get with a flu also, but who have concerns or who might be in an area where we know that the virus is circulating. And they're very frustrated and concerned because it has been hard to get that testing. Now, we know that capacity is finally ramping up in the country. The problem is it's not necessarily ramping up exactly where you are at the moment. And so the important thing to do is to listen to your local radio station and get on social media and follow the local health authorities and get information that is going to work for your area. Find out the latest, what the recommendations are, how you might get tested, call your doctor. They're receiving many calls. I think a lot of our doctors don't necessarily go in. If you are fairly healthy, you're just having a fever and some symptoms, try to see if there's a way to get testing. In some places there are places where you can drive up and get testing. They'll come up to your door, and that is less exposure for health workers. So all sorts of different things are starting to roll out around the country. It just is going to be a very local thing.
When you talk about the fever, the kind of standard temperature fever to be really worried about, from what I understand, is roughly 102 to 103. Is that correct?
Somebody else asked me that this morning, and I have to say I need to look up what the current exact temperature is. I mean, presumably because we know that the coronavirus can cause a range of illness, including very mild or even asymptomatic. It's possible that young, healthy people may not even have symptoms. So I'm not sure there's an exact temperature number, but what we can say from the thousands and thousands of patients who were studied who had this in China, and the doctors very quickly did some research, they reported that the number 1 and 2 symptom were fever and a cough, sometimes diarrhea, sometimes a runny nose, but less often that, much more the flu-like symptoms. But it's nonspecific. Those, again, could be caused by a range of things. So that's why it's important to, understand what the local health authorities are recommending. Certainly, if you have those symptoms, do not go to work, do not go to school. And if you have people in your household who have chronic illnesses, diabetes, lung disease, or who are in the older ages, and I'm not even talking that old, like the risks of a more severe version of the illness go up with age, tick up slightly in the 40s, more in the 50s, and definitely quite high in the 60s, and then going up from there.
If you're just joining us, we're speaking with Dr. Sherry Fink, wrote an article in the New York Times on the government's response to the outbreak. Okay, so this might be very difficult for you to answer, but we hear that the average age of people that are actually dying from the coronavirus is around 80. Why is it that there have been some younger people in their 20s and 30s that have died from it in China? And if you're in your 20s or 30s, do you think that there's a possibility that people could die from this illness, even under the age of 40 in this country, for example?
Well, certainly. So it's all about averages, right? And there are always exceptions to that. And the virus meets the human being. And so your body's environment may be different for whatever reason. So, there is still risk. It might have to do with the quote-unquote dose of virus you get. So you saw that, young doctor in China who died, the heroic one who tried to raise the alarm about this outbreak before the authorities would let him. And he died. He had very severe illness. I think he was in his 30s. But, of course, he's a doctor. He may have come in contact with a bigger dose of the virus, which sometimes can make a difference. But the other thing to say about age, and I think it's really important, and we're not talking about this enough, is that we are in this together. So it is not enough to say, and I've heard some of the public health authorities say this, if you're older, stay away from crowds. Don't go into, don't go to church or don't go to that basketball game. Well, now we know that that won't be happening.
Right,
but it's not enough because if they have someone in their household who's young and is going out and getting sick, actually the biggest risk is to be catching it from a close contact. So we need to think not about our individual risk like we usually would think, oh, I'm young, I'm healthy, I can kind of get around with a cold, I can go to work, I'm a warrior. But, that's not a good thing to do. We need to think of like societal risk and all act when we make our decisions and our personal choices, they should be choices for the better of all of us. So that's really important. The less that this spreads, the better it is for everyone.
Now, as far as the virus specifically, which part of the body does it attack? And when it attacks that part of the body and there is an immunity issue or there is an underlying health condition or there is an age issue, why does that lead to death?
So it's typically been pneumonias. Pneumonias that get very severe and lead to very severe what they call respiratory distress. And maybe then, all the systems of the body, when they're that stressed at that point, you sort of can have that impact, and you can become critically ill, and then it's kind of like a runaway train at that point. So, but it's kind of similar to what we see with other viruses, just the severe, once the weeks play out and it starts as something mild, develops into pneumonia, difficulty breathing, and where you'd need hospital care, and then in a fraction of those cases, getting critically ill. And I say a fraction, it's a small fraction, but it's still higher than a very bad flu season where we see a lot of death. So some models say that this could be like 10 times worse than a bad flu season. Which is scary. And that's an impact on our whole health system. This is why I'm saying the more that all of us can kind of distance from each other, do all the things we're being told, then there's not going to be a big hit on our health system, like with so many people getting sick at once, so that the health system wouldn't be able to help us with lots of other issues that we might
So you're saying it's basically a great time to be an introvert then?
Yeah, stay home.
Yeah, there you go.
So stay home a little more.
So,
I have a friend in China who's told me, they were forced to stay at home for a long time. He said it's been like a revelation. It's going to change how they live well into the future. There's some benefits that they see in it.
So, Dr. Fink, I know you wrote an article in the New York Times on the government's response to the outbreak. And again, I'm not trying to make this political, but I think it's important we do discuss this because there are some health experts that are saying that the administration has struggled to strike an effective balance, between encouraging calm and providing key information leading to, an assertive response. So can you talk to me just in general terms about the government's response to this, Mike Pence, and were they slow, to get serious in regards to the coronavirus?
So, yeah, we talked about that at the top with those little cuts from Morning Joe.
Right.
And there has been confusion because of a perception of mixed messages. And, frankly, it is it's hard to – it's called risk communication. There are people who spend their whole careers in how do you speak to the public when there's a serious epidemic happening? What's the effective way to help all of us understand what's going on when our leaders speak? So I would just say – yes, that was definitely, there are a lot of people who feel that could have been handled better. And the other big thing is testing, because unfortunately we lost a number of weeks as some issues came up with the official CDC test, the Centers for Disease Control and Prevention, for coronavirus. And it didn't get out to the public health labs in the states, or it did get out, but it wasn't able to be validated. The test wasn't, they were having trouble using it. So that stretched out some time. The FDA process for the private labs to get approved took time, and unfortunately that meant that, and we now know in places like Seattle, that the virus was circulating without anyone knowing. And that's also a very unfortunate and deadly aspect of the response so far. So it is really the moment for all of us to pay attention, be serious. It's certainly that message from the White House last night certainly seemed like we are in that phase now, unquestionably, as a country.
So in your opinion, is this the coronavirus, is it the most lethal and contagious virus you've ever seen in your lifetime?
So no. So good to ask that, because those are two aspects. One is how contagious it is, how easily it is for me to pass it to you, or hopefully not over the phone here from New York to Las Vegas. And yes, this virus is super transmissible. It is on the order of like a really very transmissible flu, a flu that can be easily passed from one to the other. And I should say this is a coronavirus, so technically it's not an influenza virus, but it's behaving somewhat the same. And coronaviruses, this class of viruses, do cause colds. So that is one thing. It is easily passes between people. But in terms of its deadliness, so like I said, I think it's the estimate maybe, and I could be getting this wrong, but on the order of like 10 times as bad as a seasonal flu, which, as we know, already causes tens of thousands of deaths in this country. So that is significantly bad, but it's not like Ebola bad. Ebola, I worked in West Africa, reported on that big Ebola outbreak a few years ago. And if you get that virus, we were seeing in the places where I was reporting, upwards of 50% of people who got that virus would die. This is not that case. This is, they're still not sure, but maybe it's 1% to 2%, maybe even less, because there might be asymptomatic infections that aren't in that denominator. So no, it's not the most deadly virus. The issue is two things. It transmits easily, it is more deadly than a seasonal flu, and none of us are immune. So that means way more people could be infected. There's no vaccine yet. We don't have immunity because it's a brand new virus. That's what makes this serious, is just the volume of people who could be infected, and if we don't take steps, who could be infected in a short time period and put a huge burden on our healthcare system and obviously other aspects of society if so many people are sick at the same time.
Okay, say I'm at a grocery store and I'm trying to buy toilet paper, which obviously I cannot do at this point, and
Wow.
someone else who has the coronavirus touches something in the grocery store, and I touch that same thing. How long can that virus sit on a placement, how long can the virus sit on a subject?
Every virus is different, and there are, environmental scientists who test these kinds of things. I think there are still different estimates coming out of this virus. Again, brand new virus.
Right.
They have to do the studies. What we do know is that, viruses can sit on surfaces, some longer than others, and the smart thing to do is if you're out and about, don't touch your face, don't touch your nose, mouth, eyes, because if you happen to have touched something that has that virus on it, then and you touch one of those parts of your face, eyes, nose, and mouth again, that is one way that you can catch this. So you want to be washing your hands before you do something like that. And the other way is if somebody's coughing, you need to be 6 feet away from them, hopefully even further. But that's the other way that this could transmit, through those droplets when somebody coughs.
So, Dr. Fink,
I'm going to have to jump off because I'm in the middle of writing another story.
No problem.
It's been really lovely to join you today.
Listen, Doctor, I appreciate you taking some time to join us. Thanks so much. If I could just, in 30 seconds, pretend like you're the president for a second, and then we'll let you go. What would you say to the American people? Well, what would you say? The reason why I asked that is, what would you say to the American people? You have the world stage right now. You have a tremendous amount of knowledge when it comes to this. In 30 seconds or so, you're talking to the American people right now. Go. What would you say?
I'm saying I'm going to double down on what I said before, which is, guys, we're all in this together. We got to think not only of, I'm 25. I looked at the risk. It's really low for me. It's going to be like a flu or a bad cold. So I'm going to go out and about my daily life. No, do not do that, because there are many people who are at risk, and if you get it, chances are you could pass it to one of them. And that's going to be bad for all of us, because then society shuts down, our hospitals are overwhelmed, and if you break your leg, you're not going to get in, hopefully this doesn't happen, but it's really to emphasize that we're all in this together. We need to care about each other. We do need to overcome those divisions. Whatever your politics, it's time to pull together and listen to what the experts say. Don't get caught up in what a politician says. It's just not helpful right now.
No, you're right. When it comes to this coronavirus, I couldn't agree with you more. Doctor, we know how busy you are, and we really do appreciate you taking some time to join us. Keep up the great work. Look forward to reading your next article, and thank you so much for joining us.
Thanks. Stay safe, everyone.
Thank you.
Thanks a lot, Doctor.
You as well, Doctor. Thank you so much. That's Dr. Sherry Fink. I bet you she didn't think that a month or two ago she'd be on all the national networks doing interviews. She was on CNN the other day. She's been on Fox News. She's been everywhere because she is so good at dealing with this issue. And, there's plenty of brilliant doctors out there like her who are doing whatever they can to try to get the word out and to help people. Yes, and she's right. No question about it. She's right. This isn't a time for politics. This is a time to bring the country together. But with that being said, we're in a very difficult situation right now. People are not able to be tested. The majority of the people that have this virus right now don't know they have it because they haven't been tested. It's a very dangerous situation. And she makes another fantastic point, which is this. I'm 39 years old. I'll be honest with you. I didn't feel very good waking up today. I don't think I have the coronavirus. First thing that entered my mind. But it's not just about me or you or people in their 20s or 30s. If you're outside and you're at a supermarket, like you said, JD, or you're at a gas station, whatever the case may be, you're putting the elderly at huge risk. Because if you don't know if you have the coronavirus or not, but you're young and you say to yourself, you know what, I'll be fine. And you leave your house, it's selfish. And it's selfish because let's just say you're at a gas station and you're filling up the gas tank. Then you got a 75-year-old man that uses the same, gas tank that you use. Or I guess I'm not using the right terminology there, but you understand what I'm saying.
Yeah. Well, I'll tell you this, man. My grandfather, he's in, and we've discussed my grandfather before, but he's in Council Bluffs, Iowa. He's 83 years old. He lives in a nursing home. It's not an acute care facility like it was in Kirkland, Washington, where all those deaths took place. It's not, a step below hospice. It's just a place where the elderly live. It's a retirement home. And he is in lockdown right now. He can't go. He can go to work and work with my father, but he can't go anywhere else. And so I think that you're not going to see a lot of 74-year-old men and women at gas pumps. You're not going to see bingo halls filled with the elderly at this point. I think that as long as everybody just understands that we're trying to contain this virus and you need to leave your house to do as minimal as possible. What I'm going to do, I'm going to come here, I'm going to go to the store, go to the gym, and that's it. No casinos, no nothing. Now, is it great for the economy? No, it's completely terrible, but it's necessary for survival of the United States of America and for the elderly people of the United States of America. And you look at places like Italy. Has Italy had a lot of deaths? Yes, but Italy's also has the oldest population in the world. 60% of Italians are over 40 years old. And the average Italian drinks wine every day, eats a lot of carbs, and smokes a lot. So they're probably not in the best health as it is. But if you look at the actual numbers, if you're 80 years old, you've about a 15.6% chance of dying of this illness. If you're anywhere from 30 to 39 like you are, Brian, you're 0.2%. I'm 0.1%. And that's if I have underlying health conditions. You do have an underlying health condition.
Yeah, but when you think of
but you live a relatively healthy life. You don't eat great, but you get the flu shot, etc. So you're actually not much of a risk, but the problem is you're putting other people at risk when you're going out and you're putting yourself in public just to do something recreational. The recommendation at this point is to stay away from anything recreational regardless of your age.
Does that mean dating as well? Because, boy, I'm gonna have a very boring weekend.
That does mean dating. It means a lot of Netflix.
What about concerts?
It means a lot of.
What about all the shows this weekend?
I'll tell you this, Brian.
I'm supposed to see Billy Idol tomorrow night. Is that canceled?
Just because of what happened, I got actively involved in the stock market last night. I put down a major put on Live Nation, who's owned by Liberty Media, because I think their stock is just going to drop through the roof. EDC was just canceled, by the way, last night.
Mm-hmm. Yeah.
Stagecoach, Coachella.
And when was EDC supposed to happen, by the way?
Oh, it happens in late April.
Late April.
And the NFL draft, they just announced that the fan activities, which was going to be huge, will be canceled. So all those Hall of Famers that you thought were coming into Las Vegas, probably not going to come.
Our one of our producers just told us that it's actually in May, and it's incredible now that they're canceling events that are 2 months down the road. That is incredible. And it also, I'm sorry, but I got to bring this up. What about the NFL draft? Is that next? How about the Major League Baseball season? They can't start in a few weeks. I'm telling you, the NHL is going to be done. Major League Baseball, how could you, hold on. If you're Gary Bettman, how do you defend the NHL continuing their season when the NBA just canceled theirs, at least for now? You can't, right?
Okay,
you can't defend that.
So what just happened with the NHL is that arenas have been asked to give availability through July. I think what they're expecting to do is suspend for the next month, see what happens with the containment of the virus or the spread of the virus, or see if any players test positive, and then finish the regular season. They might just jump straight into the playoffs. I mean, that's probably what's going to happen with the NBA and the NHL is they just jump right into the playoffs. In the current standings as they sit, that's how it works. That's my estimation. Major League Baseball, I'm guessing, I think the season is still going to happen, but it's going to be about 2 weeks late. That's my guess.
It's not going to start on time.
No, they already announced that the home openers for the Dodgers and the Angels have been moved from March 30th.
Yeah, and that does not surprise me one bit. Like I said, folks, it feels like we're in a movie. It doesn't feel like this is real. Never in my lifetime did I ever think that the NCAA tournament would, first of all, not only happen, but definitely not with fans in attendance, which is bizarre in itself. how can the NCAA even have an NCAA tournament now? Think about the logistics of it. You have these conference tournaments that are not even going on. How do you crown a champion? The regular season? That's not going to work. There's no way that the NCAA tournament is going to happen at this point. Can we all 99% chance that we don't see the NCAA tournament?
Well, I mean, considering the fact that either maybe they could do 32 teams, I guess that's a possibility.
I don't think so.
Pretty unlikely.
I don't think that's going to happen.
You've got all these locations that have been preparing for years, and they pay big money to be a part of this tournament. So there's going to be a major insurance policy that's integrated there. But you've got all these small conferences who have their one automatic bid who are canceling their tournaments as well.
Yep.
So you're going to have 10 or like the Big Sky, the WAC, WCC. A lot of these smaller conferences, or these non-Power 5 conferences, are not going to be able to finish their tournaments, and they're not going to be able to have teams enter this tournament. So, yeah, I think there's probably a 90% chance that the NCAA tournament for the first time in history will be canceled.
I don't know if you guys realize this, but among all this coronavirus, we do have a presidential election coming up. Joe Biden, by the way, just found out that he has a new campaign manager. People are saying Joe Biden, is he senile? Well, the guy coming up next, his name is John Gartner. He says that it's Trump that has the mental issues. He's a psychologist. John Gartner, coming up next. This is the Vegas Take.